Hi, my name is Ariana Meacham, and today I will be talking about the issue within the juvenile justice system that pertains to juveniles and disabilities. I have recorded this video 5 times, so I will be reading off of a paper more than likely because I cannot memorize this. So, just a heads up. According to the Coalition of Juvenile Justice, it is estimated that 70% of juveniles suffer from a mental, sensory, or learning disability. It is said that between 23 and 48% of juveniles have special education needs. It's also said that the minority youths are disproportionately affected by this due to the poverty line and family functioning. It is said that African American youths are 43% more likely to have a learning disability, and that American Indian youths are 80% more likely to have a learning disability. The rates of emotional, behavioral, learning, and developmental disabilities are much higher for juvenile offenders. The most common diagnoses include attention deficit hyperactive disorder, learning disabilities, anxiety disorders, depression, developmental disabilities, post-traumatic stress disorder, conduct disorder, and substance abuse disorders. Not only can these undiagnosed disorders contribute to delinquency, but the minimal access that these juveniles have to things like mental health services and special needs services also contribute to future recidivism rates. Not having family support, the system support, and when the court assumes that a juvenile's action is willful and not at all contributed to a possible disorder, in turn reinforce school failure and opportunities for delinquent behavior. Those are the current conditions within the juvenile justice system. There are kids who have undiagnosed disorders and are sent to court when a lot of the times court intervention may not even be needed. Or they are tried as adults and not given a chance to get better. The children who do have diagnosed disorders have little to no access to those mental health services, special needs services, or even schooling, and their development stops the second they're put behind bars, leaving them in a perpetual state of criminality, because what's around them is criminal activity. What's around them is criminals. So they're put here, their development is stopped as young at the age of 14, it just stops, and that's what they're around, so it raises recidivism rates. Some strategies could be to engage the police more in our communities in an attempt to lower arrest rates of juveniles by making community policing the norm in hopes to allow officers to get to know the juveniles in their own communities, allowing officers to know what normal behavior is and what abnormal behavior is for some juveniles, allowing them to see if a juvenile is acting as they normally would or as they normally would, and allowing them to get to the bottom of it as a way to identify if something deeper is wrong with that juvenile offender. This could help law enforcement see family troubles before it leads to delinquent behavior, or even worse, it can create a stronger bond with law enforcement, encouraging juveniles to trust the police and come to them with problems or to come with them when they see criminal activity taking place. Another strategy in the system could be to identify these disabilities and pay attention to the needs of these disabilities by implementing the use of screening assessments that have proven to be reliable in identifying disabilities early on in life. What I mean by that is when you arrest a juvenile for a serious crime, it should not be cut and dry. There should be tests done in order to see if there is a disability within the child, making sure that those who will interact with the juvenile will have a clear understanding of the disability that individual has, as well as, we need to make sure that those who will interact with the juvenile will have a clear understanding of the disability that that juvenile offender has, as well as they have an understanding as the link between the disability and the justice system involvement. We need to establish mandatory procedures to review the adequacy and scope of accommodations offered before any child is referred to a status offense court or criminal court. In order to be able to help a juvenile become successful in a life outside of the system, they need to learn how to control their disability and manage it. Some action plans would be to implement programs that promote self-awareness, social skill building, and strategies and coping skills to reduce impulsive or delinquent behavior. Community youth programs or programs in the juvenile justice system should be easy for all youth to access regardless of detention status. The point is not to punish a child for the mistakes they made, but to rehabilitate them so that they can become a functioning member of civilization and live a full life in order to learn from the mistakes they did make. Family intervention should also be implemented as a way to discuss disability needs, characteristics, problem solving, and child management skills. Families should be able to work with their youth on their progress. Not only will this raise awareness within the family youth constant needs due to the disability, not only will this raise the family's awareness on the youth's constant need due to their disability, but it would also give the youth support and encouragement to continue on this path. Not to mention, all of this can help the juvenile system focus more on rehabilitation and developing the minds of the youth they have locked up rather than punishing them and throwing away a key. We can do all of this a little at a time or all at once. It doesn't cost much for kindness and compassion. Many court systems have psychiatrists on hand or at least on retainer, and it wouldn't cost much money to have them come out to evaluate a child. Same with the screening test. It doesn't cost much to implement an extra test before sentencing a child or looking over a case file. Youth programs can be funded by the community, and if they turn detention centers into youth programs, they're not shelling out extra money. They're restructuring, and that's basically free. Adding a little education here, some mental health services there, so on and so forth. In the long run, rehabilitating juveniles and preventing them from recommitting a crime will be less expensive than housing thousands of youths in prison. And that starts with acknowledging that there are youths who have disabilities in prison who need the extra help. So turning a detention center into a community youth center for youths who are detained is smarter than putting them somewhere that resembles a prison. Children don't learn in confinement, especially children with learning disorders. It's much harder for somebody with ADHD to pay attention when they're forced to sit in one spot. Children learn differently. They learn right and wrong differently. You cannot just black and white this when you're trying to teach children with disabilities how to act right and wrong. It's not black and white. They don't learn the same way as the general population. The Coalition for Juvenile Justice even said that 20% of juveniles who have learning disabilities will commit suicide later on in life. I don't know, maybe it's just me, but the juvenile justice system needs to step up its game with how it treats youths who are incarcerated who have learning disabilities. They need better access to mental health services, special needs services, and they absolutely need the court's support behind them 100%. Thank you for coming to my TED Talk.